people for the better part of a decade have been cutting and pasting what I'm doing and getting the same to similar results all over the world. The root cause of SI joint dysfunction is this. Here's the big secret. And these can be very tricky, but you can't give up. Because if you give up, then these people go back out into the medical system and they're screwed, because then the reason why I'm so passionate about teaching this so much, especially SI stuff, or chronic pain in general, but SI stuff is because what I see in here in this clinic where just about everybody's failed everything is a tragedy. Hey everybody, what's up? Physical therapist, Dr. Ryan Whelton, coming to you from just outside the beautiful Tampa Bay area. If you're new to following me, I got a clinic where just about everybody's failed everything type thing. If you want to follow me on there, click follow or subscribe. Today I am talking about why I was bleeding during an SI joint evaluation for the first time. So I don't know if you can see this. You can see that right here. That is my own thumb mark. And then I don't know if you can see that right there. That is my thumb going into myself. So I injured myself doing an SI joint evaluations. Okay, so why this happened? I had a patient that had a stiff pelvis, okay? Now, the more you do this SI joint stuff, I published my SI joint protocol. This particular person had an extraordinarily stiff pelvis, okay? And when you do these evaluations all day long for SI joint, you start to pick up on the fact that some move more than others, but this guy had a stiff pelvis. And when I tried to open up his outflare of his pelvis, which I will show you what I did, I didn't even know I was doing it. That's how hard I was pulling. I was pulling this guy's outflare open like this, and I was sticking my other finger into my other thumb, and I didn't even feel it. That's how hard I was pulling. I was shaking to try to get this guy's SI joint open. So just to review, okay, the root cause, read my paper on my website, wheltonmethods.com. The root cause of SI joint dysfunction is this. Here's the big secret. It is caused by an upslip and or outflare of the pelvis. Up, out. That's the big secret. So you pull on their leg, and then gap open their ASIS immediately. So you gap open the SI joint, or sometimes you have to hold it open, and then boom, their SI pain goes away, and a lot of their quote-unquote radiculopathy, like this particular gentleman today, had pain down his legs, and when I finally got it open, the pain down his legs was gone. Now notice I colored in the groin region. I've seen people with testicular pain. I did a whole video about it, as well as the top of the foot. I've seen people with foot pain from this, as well as all neurological symptoms SI joint can cause, including foot drop and weakness in the quad. Weakness. If you go to my YouTube channel, Whelton Methods, and you would like to see what shocked me was two patients now who had foot drop. And I opened up their SI joint, and immediately they went from like a 3- out of 5 to 5 out of 5 strength right there. And you can see me do it. Strength, no strength, full strength, right after open up the SI joint. So I'm kind of rewriting the book on SI joint dysfunction. Okay. Now, remember, read my sacral paper on my website. I hacked that evaluation. It's way too complex the way they teach it in school. I figured out how to make it much more simple, how to diagnose sacral dysfunctions, which always in the chronic pain world, chronic low back pain world, especially the ones that nobody can figure out, my left thumb will dip on a prone press up test or standing flexion test or sitting or whatever. And that means you have to strengthen they'll have a weak right piriformis, test it in a 90-90 test, and you strengthen the right side. So that is SI joint dysfunction. Okay. Now, in this particular gentleman's case that I was bleeding after, he had this outflare. His pelvis was so locked that normally you can feel it move, but with this guy, when I got on the table with him and I was going like this with a hydroc pad just to kind of pad the ASIS because it's tender on everybody there. When I was going like this, it was going. I was pushing really hard, and I'm like, oh no, this is a stiff one, you know. So it's it's like barely moving. So I'm like, I hope this guy's pain's gone because I know what I'm in for after in terms of trying to get this thing open, getting on the ground and hooking my arm around and trying to get it open, my biceps like shaking, you know. And this guy had a very stiff pelvis. Okay, so let me show you how I diagnosed it. And these can be very tricky, but you can't give up. You had a herniated disc, but that wasn't causing your pain. Okay, so Annette, can you come here for a second? Okay, we will go over SI joint dysfunction again, how to diagnose it, and then I will show you how to diagnose these really tricky stiff ones. So, everybody know Annette, the Vanna White of physical therapy. Stand here, face that way for me, please. So, you put your thumbs on the PSIS right here, okay, and you have them extend back, okay? And you will see that, let's say she has a left upslip, the left thumb will translate superiorly, okay? So what you do is you pull on the person's leg. So go ahead and lay on your back for me, please. And I say, have you ever had hip surgery? Always ask the patient that. If you pull on a total hip replacement, that person goes right to the emergency room. Have you ever had hip surgery? And she says, no. Okay. I said, I'm going to pull on your leg. It doesn't hurt, just a little bit of a tug. Is that okay if I do that? And then I pull. And you want them to slide on the mat with you because sometimes you don't get it. But I found if the person slides, and don't turn your torso because that'll hurt your back. Just drop your hip and pull. Okay, body mechanics will save your back, and you don't end up like an SI patient. Okay, so then I have them stand up, face that way, and then I would do the same thing, arch back. Okay, now let's say my left thumb is translating inferiorly like my right thumb. Boom, I got the upslip. But the person usually still has pain, especially in the chronic pain world. And that's because they have the out flares, okay? So what I do after that is go and lay on your side face that way for me, please. Okay, so I'll take a hydroc pad, get a pad, something, pillow, whatever you want to do. And what I do is I say, I got to push on the side of your hip. It's tender on everybody. Let me know if it's too much. And what I'm doing is I'm pushing medial on the ASIS and gapping open the SI joint. You can even put your finger on the SI joint and you can feel it moving open, okay? And gapping open, I'll do that for 20 seconds or so. And then I have them stand up, okay? I do that on both sides, unless they're just pointing to one side, but I'll do it on both sides because a lot of people with pain across their back is actually just bilateral SI. So I'll have her extend back and I'll say, is that pain gone, right? And she says, no, okay? And that means that they need more force. So a lot of times what I'll do is I'll push medial on the ASIS, hold it there and extend back. Go ahead and arch back. Okay, so a lot of times that'll work. So what I'm doing is pushing medial on the ASIS bilateral, holding it there and having them extend back because that was their aggravating motion. It usually is some flexion, but most extension. So I say, go ahead and extend back. And okay, is your pain gone? If they say yeah, well then you got it. Okay, but if they say no, then it's just too stuck like this guy this morning that made my hand bleed. So what I do is I put a ball between their knees because adduction, gaps open, does that, right? So that helps me along. So, and this is great to help patients understand that, during the rehab process that they still have groin weakness. They have them squeeze the ball, extend back, and their pain's gone after you get the upslip. So squeeze the ball, please. Arch back, okay? And the person says the pain's still there. Then I come around and I push harder. Medial on the ASIS bilaterally. And what I do is the pain's still there. If they say no, then you got it. If they say yes, then like this gentleman this morning that made my hand bleed, what I have to do after that is I put the ball between the knees Okay. And then I actually got on the ground. This is what I do for the stiff ones. And a lot of times I'll have her come and hold the ball for me, so it doesn't pop out. Okay. And what I do is I put one hand on one ASIS. Okay. And I wrap my hand around to the other ASIS, and I'm hooking it. And what I do is I push both immediately, and then I'm usually shaking and struggling to talk at that point. And I say, go ahead and arch back for me. And if they say, that the pain's gone, okay, great. But if they say no, I say squeeze harder. So they squeeze the ball harder, extend back. If they say no, it's still there. What I do is with this guy, I hooked my my whole wrist around his ASIS, and I pulled like that. Okay. And the reason why my hand bled is because it only hurt on this side. So I was going like this with my shoulder, and I was just trying to get that side open, and I ended up sticking my fingernail inside my hand, and I had no idea I was doing it because I was shaking so bad trying to get this guy's SI joint open. Thank you. So that that is how I diagnose SI. That's the procedure to diagnose SI. Okay. And you got to keep at it. And ladies, I'm not a weak person, but I struggle to get some of these SIs open. So you may want to get some help in the clinic or ask one of the guy therapists. Don't be bashful about it. I mean, so the next question is let's say you have a patient with a stiff pelvis. Now, I thought, just by common sense, that one of my patients had a really stiff pelvis that I struggled to get open the outflare, that like this is going to take a lot of groin strength to open it up, right? To open up the outflare. And like they surprised me, like they're like, it's, like a lot of them are like, an 8-week rehab, something like that. And it's just like, wow, well, some of my other ones that aren't hard to open, I mean, those long haul SI rehabs, if you watch my video on that, I mean, some of them take months and months and months to strengthen their adductors. So it's one of those counter logical things, like, oh wow, like I have to pull that hard to get it open, but then you have them do the exercises, increasing the weight with their adductors. Every time they hit 3 sets of 30, they go up in weight. Men 5 pounds, women by 3 pounds, keep going up, 5, 10, 15. My average chronic SI patient takes 10 to 20 pounds to open up their outflares, and some need to go higher. Okay, and that's men and women, 10 to 20 pounds. It's very rare someone in this clinic that has had chronic pain, back pain, can open up their SI without that 10 to 20 pounds. So then another thing to keep in mind is when you hold open their ASIS immediately, and you get the upslip first. You have to get the upslip first, otherwise the person will still have pain when you gap open the ASIS immediately. But when you hold it open, what happens? What you can do is when you hold it open with this guy that made me bleed this morning, I asked him, do you still have that pain on your left, on your left SI? He said, no. And I said, is that pain down your leg gone? And he said, yeah. And he was actually had a background in nerve EMGs and nerve conduction of. So he disagreed with me and said, when I showed him what happened, and I said, he disagreed with me. He said, no, how could this not be nerve? And I said, I didn't touch your spine today, did I? He said, no. I said, I opened up your SI joint. I touched your pelvis and your sacrum, and your pain relieved. I said, how could this be your spine? And they usually get it at that point. Most people don't argue the point, but this guy, not in a mean way, was just asking me, wanted to know why this wasn't a nerve issue. He's like, I've done these for years, these EMGs and NCVs and all that stuff. And I'm like, I didn't touch your spine today. And you just so happen to have the great imitator of sciatica. Okay. So, anyways, that's that. Okay. If you want to learn more, you can download my Rehab. Everything's online. My online Rehab results course, which is my orthopedic protocols. I give you exact sets, reps, everything. You just cut, paste, plug and play. Work. You can do it day one. Okay. And then I have my the F-bomb method that people call it, which is the myofascial course. Really amazing, actually. And I also have my intro shoulder course for that, which is money back guarantee, 99 bucks. If you can't relieve the pain of the majority of the people you attempt the method on, we'll give you your money back. Okay. It's pretty amazing. So, and then there's the sciatica cervical ridic course, which works on about 80% of my patients, immediately wiping out sciatica cervical radiculopathy. I know I even have an MD now who's a pain management doctor. God bless him. That's amazing. He loves the course and told us he loves the sciatica cervical ridic course, and he's using that circuit of points that I found and getting great results with it. So good for you, man. Most most MDs are injecting people, but he's actually trying to do it naturally. God bless him. Um, and then I have my VIP Inner Circle, which is all this new stuff I come up with. I'm an innovator. I'm always coming up with new ways of doing things, and also a new science I'm working on, which I'm starting to put into that group. And then I also have my Rehab results-based, cash-based business model. So that is everywhere I went in the United States when I traveled and taught. Now everything's online, but I used to travel, and someone would come up to me at every place. Hey, will you teach me how to run that clinic you have in Tampa? And I'm like, no, not interested. I'm more of a clinical guy. And then, after a while, I was like, you know what? These people gave up going to physical therapists. These chronic pain patients that I see all day long, they gave up. They heard them. They're just tired of it all, And I'm like, they're not coming in. I talk to them all day long, They're not. They're A lot of them are like, I gave up a long time ago, but I saw, what you were doing, and I figured I had to give it a shot. So I figured that if I could teach people how to market this and market to your community and show them that you can fix these issues, then they will come in and give it a shot. So anyways, I show you everything. I give you all the financial stuff, how to talk to patients, what to do, what to say, all of it. It's really a game changer. And I'm also starting I'm going to start a mentoring program where either by group or one-on-one, but we'll meet and I'll go over a mentoring, coaching, how to diagnose and treat. We're interactive. So like a live Zoom call where you all can ask me questions, and you can even bring in difficult patients that you're treating, and we can all watch, and I can help guide it as to, okay, well, this is what's going on, try this, and, we'll all do it together and everybody will learn. So I know a lot of people, shoot me questions or, call my office and say, will you ask him this? Will you ask him that? Where I have a patient that has this, that, the other thing, what do I do about it? Well, I'm going to be available now, and I'm going to be available to answer your questions live. So that is going to be really cool. So you always check my website. I'll announce it, of course, but check my website. Okay. Other than that, peace. Love you all.